Is fine needle aspiration safe for bone cancer? Imagine a tiny needle helping doctors unlock the secrets inside a suspicious bone growth. That's what fine needle aspiration is all about. It's a procedure where a very thin needle is used to take a small sample of cells or fluid from a bone lesion. This sample is then examined under a microscope to see if the cells are benign or malignant. Fine needle aspiration is generally considered a safe procedure for diagnosing bone cancer. It is minimally invasive, meaning it causes little discomfort and usually no more than a mild soreness at the site. Because the needle is so thin, the risk of bleeding or infection is very low. Most patients experience only minor bruising or swelling afterward. Serious complications are rare, especially when performed by experienced clinicians. This method has shown high accuracy in diagnosing bone tumors, with studies reporting around 95 to 97% accuracy. It is also highly sensitive and specific, meaning it is very good at correctly identifying cancerous versus non-cancerous lesions. Because it is quick, cost-effective, and less invasive than open surgical biopsies, it is often used as an initial step in the diagnostic process. However, like any medical procedure, there are some risks to keep in mind. Minor bleeding, bruising, swelling, or infection can happen, but these are usually manageable with proper care. In rare cases, there could be injury to nearby tissues or organs, but this is uncommon when performed by skilled professionals. After the procedure, patients are monitored, and any unusual symptoms such as worsening pain, fever, or persistent bleeding should be reported to a healthcare provider promptly. In the context of diagnosing bone cancer, fine needle aspiration is often part of a broader approach that includes imaging tests like X-rays, MRI, or CT scans. Sometimes, a core needle biopsy might be needed if more tissue is required for a definitive diagnosis. The choice of biopsy depends on factors like the location and size of the lesion, as well as the suspected type of tumor. Overall, when performed by experienced clinicians, fine needle aspiration is a safe and effective way to gather important information about bone lesions. It provides quick, reliable results with minimal risk, helping doctors plan the best course of action. If you or someone you know is facing a potential bone tumor, it's essential to discuss all options, benefits, and risks with a healthcare professional to make an informed decision tailored to individual needs.